Hello everyone, this is Dr. PJ. Today, I have some great news that I've been really excited to share with you. And it's this right here. Our clinic has officially received the Rejuran SVIP certification. This certification is awarded by Pharma Research, the manufacturer of Rejuran, to medical institutions that constantly use authentic Rejuran products in proper amounts and demonstrate extensive clinical experience and contribution. Among these certifications, the one we received is the highest level. What makes this even more meaningful is that our clinic achieved this milestone in just a little over 1 year since opening. It's also recognition that places us within the top 1% of Rejuran treatment providers in Korea. With such a meaningful certification, I think it's the perfect time to explain why Rejuran is such an effective treatment and how you can get the best possible results from it. Rejuran, explained directly by a dermatologist from a top 1% KBeauty clinic. Let's get started. Rejuran is completely different from what we usually think of as fillers. It's not a treatment that simply adds volume. Instead, you can think of it as a skin regeneration injection, a treatment that helps your skin repair and restore itself from within. The key ingredient is PN, or polynucleotides, which are DNA fragments extracted from salmon. When this ingredient is injected into the dermal layer of the skin, it helps repair a damaged skin barrier, reduces inflammation, and stimulates fibroblasts to produce collagen. As a result, it improves overall skin quality, including skin thickness, elasticity, hydration, and also fine lines. That is why Rejuran is so commonly used when we want to create skin that makeup applies smoothly and skin with strong, healthy fundamentals. You've probably heard of Rejuran Healer, Rejuran HB, and Rejuran I, and you might be wondering, what's the difference between all of them? Let's start with the two most basic types, which are Rejuran Healer and Rejuran HB. Speaking of Rejuran Healer, this is the original and most concentrated form of Rejuran. It contains the highest amount of PN, 20 mg per 1 cc. To be honest, it can be quite painful. But at the same time, this version delivers the strongest and most noticeable results. Simply put, more discomfort, but also more impact. Speaking of Rejuran HB, because Rejuran is known to be painful, this version was developed to help reduce discomfort during treatment. In addition to original Rejuran ingredients, Rejuran HB contains lidocaine, a local anesthetic, and hyaluronic acid. As a result, the treatment is much more comfortable, and you also get a better hydrated, dewy glow. However, the PN concentration is lower than the original, 10 mg per 1 cc. There are also Rejuran formulations designed for specific areas and concerns, which are Rejuran I and Rejuran S. Speaking of Rejuran I, this is specifically designed for the eye area. The skin around the eyes is very thin, so prolonged bumpiness after injection can be an issue. To address this, Rejuran I has a lower viscosity, making it smoother and more suitable for delicate areas. Speaking of Rejuran S, this version has the highest viscosity. It is mainly used for acne scars or localized tissue restoration, where more structural support is needed. With so many types of Rejuran available, choosing the right one based on your skin concerns and treatment goals is key. Now, let's talk about why many of you are most worried about pain. To be honest, yes, Rejuran does hurt, and there's a reason for that. For Rejuran to work properly, it needs to be injected precisely and densely into the dermal layer, which is where the treatment is most effective. As the product is delivered into this layer, pressure builds up, and that's what causes the pain. In fact, if the treatment didn't hurt at all, there's a chance that the product may have been injected too deep into the fat layer beneath the dermis, which can reduce its effectiveness. The same goes for the small bumps you may see after treatment, known as the embossing effect. These bumps are actually a sign that the product was injected correctly. They usually subside within 2 to 4 days, so there's no need to be overly concerned about them. Rejuran is generally considered a very safe treatment. with very few major side effects because it's made of DNA-based components that are naturally broken down in the skin. The risk of long-term nodules is extremely low when the treatment is done properly. That said, bruising can still occur if small blood vessels are accidentally affected during the injection. This is more likely to happen if the patient moves a lot, especially during procedures performed under sedation. In very rare cases, allergic or hypersensitivity reactions can occur. Even if you've had Rejuran treatments before without any issues, factors like physical fatigue, stress, or a weakened condition can occasionally trigger an unexpected reaction. That's why if you have an important event coming up, such as a wedding or a major photo shoot, I don't recommend getting Rejuran too close to the date. A safer schedule is to start treatment at least 3 months in advance and to complete your final session about 3 to 4 weeks before the event. This allows enough time for recovery and ensures the most stable result. Just remember 3 key points. First, whenever possible, choose manual injections. Using a device can be more comfortable and less painful, but some of the product may be lost in the process. If you want the full amount delivered directly into the skin, manual injections performed carefully by the doctor tend to be more effective. Second, focus on problem areas rather than the entire face. You can inject 1 or 2 cc of Rejuran across the whole face, but if you want more noticeable result, it's better to deliver it with higher density to the areas you are most concerned about. Third, combine Rejuran with laser treatments. Rejuran works best when it's injected while the skin is already in a regenerative state. That's when the synergy really kicks in. If your main concern is loss of elasticity, combine with Dermatologist. If you're dealing with redness or acne-related issues, pair it with a vascular laser. If dryness or dullness is the issue, combining it with a toning laser works very well. When these treatments are customized and combined based on your skin condition, patient satisfaction tends to be significantly higher. Today, we took a deeper look at Rejuran. Rather than being a one-time treatment, Rejuran works best when it's done consistently over time, helping improve the skin's foundation and overall health. For that reason, I usually recommend about 3 sessions spaced roughly 1 month apart to achieve long-lasting and more stable results. If you have any additional questions, feel free to leave them in the comment below. And if today's video was helpful, please don't forget to subscribe, like, and turn on notifications. This has been Dr. PJ. Thank you so much for watching.